Well, I've been given this formidable task of keeping all of these people on time in what is the inaugural Data Blitz session here at the Cardiovascular Research Day. So what this Data Blitz consists of is 1 minute presentations, one slide. 1 minute, one slide. And the way this is going to work is all the slides are already loaded up, and so each person is going to come up here and give their 60-second spiel, and then the next presentation will load up. So there's no need to quit anything, everything's just automatically loaded, and I'm sure you guys have all been given those instructions already 3 times over by the amazingly organized Christine and Priya. I'm just letting everybody else know what's going on. They've even prepared a speech for me for now, which is amazing. I need to get a speech writer in the future, I'm realizing. So there'll be no questions from the audience during this time. They've asked that you reserve all your questions for the poster session, that you please join us at the very end of the day today, which will be back over in OVC in the cafeteria over there. So just instructions for the students. I'm going to be sitting right there in front, and I'll hold up this plate when we get to the 60-second mark, and then you'll know there's a little bit of wiggle room, but not too much. And I'll have my timer in front. So without further ado, let's get started. We have 15 of these presentations today, and there'll be no introductions by me. We're just going to fly through one through the next. So in fairness to all the others, I won't introduce you, our first speaker.
And my post is entitled A Preliminary Investigation of Cardiac Cell Proliferation Following a Puncture Injury to the Heart of the Leopard Gecko, Eublepharis macularis. So whereas cardiac injuries in mammals result in scar formation, there are species such as zebrafish that are capable of regenerating their hearts. And a hallmark of cardiac regeneration is the ability for cardiomyocytes to proliferate in response to injury. So here we characterize cardiac cell proliferation following a cardiac puncture to the leopard gecko. So geckos have a 3-chambered heart, and we created punctures on the ventricle, indicated here with the black hatched lines. And histologically, the wound site is characterized by a loss in myosin heavy chain positive cardiomyocytes, and at 10 days post-puncture, we see a surge in proliferation, and this surge in proliferation is associated with the wound site, but also by cardiomyocytes that border this wound site. And by 14 days post-puncture, it is these proliferating cardiac cells that contribute to the repopulation and the restoration of an injured myocardium in the gecko heart. Thank you.
Okay, we're moving from geckos to humans really quickly. So in humans, we can measure muscle sympathetic nerve activity, or MSNA. That's the neural vasoconstrictor drive to skeletal muscle vascular beds. And you'll notice in the top left, during exercise, we see a sympathoexcitation in the 2nd minute, and this is a static hand grip exercise test. Yet nothing or no response in the 1st minute. When you look in the 1st minute, there's a large inter-individual variability where this allows us to classify negative, non, and positive responder groups. And in the top right, when you compare their response patterns, you'll notice negative responders actually having an absent change in their neural vasoconstrictor drive. Yet, their hemodynamic response, including their blood pressure response, is the same as their non- and positive responder counterparts. So this tells us or suggests to us that there may be some individuals, these negative responders, that increase their vasoconstrictor drive to other tissue beds, maybe renal or splanchnic, and this is a common phenomenon in some cardiovascular disease states. Thank you.
Hi, my name is Grace. I am from the Dawson Lab. In the Dawson Lab, we heavily study the protein actin. At the sarcomeric level of a heart muscle cell, there are thin and thick filaments that's able to interact together and result in muscle contraction. Thin filaments are made up of the protein alpha cardiac actin, also known as ACC, and my specific research looks at the change of ACC's property when there's a single amino acid substitution in the protein. The specific ACC variant I study is T126I, and is a result of a genetic mutation found in a patient with dilated cardiomyopathy. My results show that this ACC variant polymerizes at a much faster rate and that less calcium is required for muscle contraction. If you have any more questions and want to hear me talk about how cool actin is, please come and visit my poster. Thank you.
Hi everybody, it's me again. So I'm Christine. I'm in Dr. Tammy Martino's lab here at Guelph. And so my study, I haven't even switched it, but there it is. My study is looking at the role of sleep and circadian rhythms in the progression of heart disease. So I think it's really important for us to recognize that here in Canada, actually 1/3 of the entire population is getting less than the daily recommended amount of sleep every night. So in the lab, we developed a way to actually extend the light period in mice, and this allows them to get increased rest every single day. And then I used a heart disease model of cardiac hypertrophy, and using our cardiac imaging techniques, we found that increased sleep actually improves heart structure and function in disease. And then we used some molecular microarray techniques to actually identify the molecular pathways that were underlying these differences and these benefits in the heart. So please come by my poster this afternoon to learn a little bit more about sleep in your heart. Thank you.
So I'm actually not hurt, but we can talk about why I'm crutching around on my poster. So my name's Chris, and I'm in Dr. Burr's lab here at the University of Guelph. And my poster is looking at the blood pressure response to blood flow restriction exercise with resistance training. And for those who don't know what blood flow restriction training is, basically you cut off blood flow to a certain area which you're exercising, and you perform multiple sets with very low weight. And previous literature has shown over and over again that it's similar in terms of increasing muscle mass and size. However, the actual safety of it really has been ignored, especially with the multi-joint exercise like a squat. So this poster just looked at that, estimating the blood pressure response using a finger blood pressure cuff. And they basically performed the exercise with and without the restriction for 3 sets to failure. And then basically I'll give you a little tidbit, but the results here on the bottom show that there is an increased response, at least when the cuff is on them during the rest periods. However, that response is alleviated once the cuff is released. So if you want to chat more about it and how it feels, I can give you a full explanation about that.
Hi everyone, my name is Leslie, and the purpose of my research was to look at how long-term splenectomy or spleen removal affected cardiac function and led to pathological remodeling of the left ventricle. So we took the spleen out of male and female rats that were 6 to 7 weeks of age, and then let them go for 52 weeks and performed echocardiography, invasive hemodynamics, and cardiac histology of the left ventricle. So if we look at the top right here, we can see that both male and female rats that have had their spleen removed have increased cardiac fibrosis, as you can see from that image in the top middle there, that our splenectomy animals are more fibrotic, indicated by more red area in that image. As well, we found that we did invasive hemodynamics, that the DPDT max and index of contractility in our male rats was reduced, but preserved in females, indicating that males have reduced systolic function and females have preserved systolic function. And finally, we looked at diastolic function, and both males and females showed that they have diastolic dysfunction. So come check out my poster later to look at our echo data, as well as see why this model has implications in females with heart failure.
Hi everyone, my name is Dell. Heart disease affects men and women differently. Women tend to be protected against heart disease up until the age of onset of menopause, when their risk rises thereafter. Clinical trials using hormone replacement therapy in women have shown contradictory results about whether they are beneficial for women's cardiovascular outcomes. Our research is novel because we look at the VCD-induced mouse model of ovarian failure, which models the gradual transition into menopause and better represents the perimenopause period than we can with the over-optimized mouse model. This is significant because women who start hormone replacement therapy during the perimenopause period tend to have better cardiovascular outcomes than women who receive hormone replacement therapy later. Overall, we look at the role of how estrogen receptors regulate the heart during the transition into menopause, and we see that this regulation occurs in a nonlinear manner. Thank you.
All right, hello everyone. My name is Priya, and I'm from Dr. Tammy Martino's lab. And my poster focuses on the circadian microbiome and how it benefits outcomes post-myocardial infarction. So using techniques such as echocardiography, in vivo hemodynamics, and histology, I've shown that if you disrupt the gut microbiome using antibiotics, this leads to worsened cardiac structure and function post-myocardial infarction. And so then when I went back to look at the gut microbiome, using techniques such as 16S rRNA sequencing and NMR spectroscopy, I found that if you disrupt the gut microbiome with antibiotics, we have a reduction in these functional gut metabolites. And so to see how this contributes to this infarct healing post-MI, I looked at immune cell recruitment using flow cytometry, and we found that in these mice with a disrupted gut microbiome, they had this altered immune response coming into the infarct. And so overall, I've shown that if you disrupt the gut microbiome, this leads to worsened cardiac structure and function. But now I wanted to know if I give the microbiome back using a mouse equivalent of a fecal transplant, can I make things better? And so if you want to know more about this, come see my poster at P8.
Hello, my name is Jordan. I'm from Dr. Miller's lab, and for my project, I was interested in whether fish oil and its different constituents, EPA and DHA, have different effects on blood pressure, which is a known risk factor for cardiovascular disease. So to test this question, we compared the effects of DHA or EPA, which are the two N3s, compared to olive oil or a monounsaturated fat to look at their different effects on blood pressure. And we hypothesized that DHA and olive oil would reduce blood pressure by increasing central nitric oxide and then reducing sympathetic outflow to the heart and blood vessels. So to test this, we measured blood pressure and sympathetic activity in men and women before and after 12 weeks of supplementation. And what we found was that DHA and olive oil similarly reduced blood pressure compared to EPA, but that DHA actually increased muscle sympathetic nerve activity compared to EPA, whereas olive oil didn't have this effect. And this suggests that DHA, instead of acting in the brain, perhaps acted in the periphery to cause some sort of vasodilation, and that sympathetic outflow increased to prevent a drop in perfusion pressure. So this could have implications for cardiovascular patients that have high SNA and blood pressure. And so if you want to know more, come to my poster.
Hello everybody, my name is Mina. I'm a postdoc of Dr. Martino's lab. Our group works on the role of circadian rhythm on cardiovascular disease. Also, it has been shown that the biological sex influence on the heart function and cardiovascular disease. Previously, our group showed that ovarian hormone can protect the female mutant mice from development of age-dependent cardiovascular disease. Also, our group found that the myocardial infarction that happened during the sleep time or wake time leads to different outcome. Overall survivorship in the female was greater than the other groups, and the female that infarcted during the sleep time showed the least mortality rates. Now I'm studying the effect of day and night myocardial infarction on the cardiac structure and function using echocardiography and inflammatory response using the flow cytometry, and the benefit of exercise after myocardial infarction using the treadmill and exercise. If you are interested about my project, visit my poster. Thank you.
Hello, my name is Tarugnath Khatua. I am postdoc fellow Dr. Tammy Martino's lab. I am very pleased to be here today to present one of my research work. The work is that garlic and its derivative reduces cardiac hypertrophy by accelerating mitochondrial biogenesis through NRF2 pathway in rat. I created cardiac hypertrophy by giving isoprotein in the rat, and then I treated with garlic and its derivatives. After checking all the parameters, I saw that garlic and its derivative reduces the cardiac hypertrophy and boosts the mitochondrial biogenesis. It might be through the NRF2 and PGC1 alpha pathway. Please come to the poster session to see all the experimental result. Thank you.
Hi, I'm Jessica, and I
conducted nighttime light and noise at the OVC veterinary ICU to benefit animal healing and recovery. So circadian rhythms are important for animal health, and studies have shown that nighttime light and sound impairs patient recovery in human hospital ICUs due to sleep and circadian disruption. So our lab found that circadian disruption actually causes abnormal immune responses and worsens wound healing post-heart attack in a mice model. So, however, the light and noise in veterinary ICUs and their effect on animal health remains unknown. So first, we put light and sound meters in 7 different ICU areas and analyzed over 28,000 data points to show that nighttime light and noise were excessively high in all areas. And then we also used a non-invasive surrogate measure for circadian disruption to determine the effect on the animal patients. And mice were placed under 3 different light paradigms, and we looked at their microbiome profiles and saw that some bacterial populations were altered. So this data can be helpful to reduce light and sound to improve healing for patients like Angel. Thank you.
Hello, my name is SOCRA, and my research project focuses on hypertension and its link to atrial fibrosis, which is involved in atrial fibrillation. So because of that link, we wondered whether treating hypertension would also reduce the atrial fibrosis. And to test that out, we treated very old hypertensive rats with a couple of antihypertensive drugs and compared that to a baseline group. So the drugs that we used were candesartan and Entresto, and you can see from the graphs that candesartan reduced both left and right ventricular systolic pressures. Over on the right side of my slide, you can see that both candesartan and Entresto reduced left atrial fibrosis, but only candesartan reduced right atrial fibrosis. Now, both of these drugs are antihypertensives, so why is it that candesartan has a better effect on ventricular pressures and fibrosis than Entresto? Visit poster 13, which is my poster, to find out.
Hello, my name is Matty, and my poster is about the outcome of E99K AXI gene expression in zebrafish. E99K is one of the AXI mutations known to cause cardiomyopathy, specifically hypertrophic cardiomyopathy, which could eventually lead to heart failure. Using total transposons, I created a transgenic zebrafish that carries the E99K AXI mutation in its genome, and conducting heart rate and phenotypic analysis, I observed that the E99K fish had higher mortality and a lower heart rate when compared to wild type. And in addition to that, I also extracted the hearts of adult zebrafish, and I observed that the heart of the E99K transgenic fish was much larger than that of its wild type. And so if you want to know more about my poster, my poster on how using zebrafish as an in vivo model to study cardiomyopathy can help us to know more information about how AXI mutations can lead to cardiomyopathy. Thank you.
Okay, hello everyone, my name is Austin. I was a graduate student in Dr. Tammy Martino's lab. And for this study, we looked at the role of the clock protein in neuromorphology and behavioral responses following a myocardial infarction, or MI. So to begin with, we started with a clock delta 19 mouse, which is a mouse that produces a non-functional clock protein. And then we compare this with our wild types. So we have these 2 groups of mice, and then we give them myocardial infarction, or MI, and we see that if we look at the cardiac structure, the clock MI mice actually show less infarct expansion versus the wild types. So this is indicative of better outcomes. Moving on over to the neuromorphology, we see that at baseline, the clock mice actually have lower apical length versus our wild types before MI. And what's interesting and surprising is that after an MI, this difference disappears. And then finally, we also looked at perception and memory tasks for these groups of mice as well to see how these differences and changes correlate with how they behave as well. And if you would like to learn more, please come visit my poster, poster 15.
Okay, well that was fantastic. Thank you to all our student presenters and to Dr. Nina Jones for chairing our session, and that concludes our Data Blitz. So thank you again.